Hi, I'm David Ward. Cardiovascular disease remains the #1 killer of men and women worldwide. If you've been diagnosed with high cholesterol or a cardiovascular disease, such as atherosclerosis, high blood pressure, or coronary artery disease, you may have been prescribed a medication to lower your risk of a cardiovascular event, such as a heart attack or stroke. Now, while medications can be helpful for lowering risk, they don't address the underlying or root causes of cardiovascular disease. Central to cardiovascular health and disease is the function of the innermost lining of blood vessels, known as the vascular endothelium. The vascular endothelium is an organ system that maintains the integrity of the entire cardiovascular system. The endothelium serves a critical role as a barrier and is involved in the regulation of blood flow through the arteries. When the endothelium is intact and functional, the cardiovascular system maintains its integrity and is protected from cardiovascular disease. However, endothelial dysfunction plays a significant role in the development and progression of cardiovascular disease. Now, one of the critical roles of the vascular endothelium is to produce a gas called nitric oxide. Nitric oxide is not a hormone per se, but it does have many similar properties, and it plays important roles in vascular health. It's essential for vasodilation, or relaxing and widening of blood vessels to improve blood flow and regulate blood pressure. Nitric oxide serves as a protector against vascular inflammation. By preventing the buildup of harmful substances in the artery walls, nitric oxide helps maintain the structural integrity of blood vessels. This anti-inflammatory function is crucial for reducing plaque formation and slowing the progression of atherosclerosis. Nitric oxide also interacts with platelets to prevent unwanted clotting, supporting smooth circulation and reducing the risk of heart attacks and strokes. The risk factors for the development of cardiovascular diseases all are known to disrupt nitric oxide production, and reduced nitric oxide is thought to be one of the central factors common to cardiovascular diseases. Endothelial dysfunction is a reversible disorder. An early detection of endothelial dysfunction and recognition of the loss of nitric oxide before the onset of progression in symptoms and disease is essential and necessary for the prevention of cardiovascular disease. So, how do you support the vascular system? Well, there's a saying, you can't manage what you don't measure. So we go beyond looking at standard risk factors in cholesterol panels and look at markers of inflammation and vascular dysfunction. We also look at environmental and lifestyle risk factors that promote the chronic inflammation that drives vascular dysfunction, including toxins and infections, sleep apnea, oral and gut health, diet and nutrition, blood sugar dysregulation, body composition, and movement and exercise, both too little and too much. Each individual has a unique combination of these factors that can result in endothelial dysfunction, so we use a personalized precision approach that identifies the root causes of deviations from normal vascular function and metabolism specific to you as an individual. We then use lifestyle-based strategies to support restoration of vascular health. This is a functional health approach that includes recommendations for diet and nutrition, movement and exercise, optimizing sleep, supporting healthy stress response, avoiding toxins, and supporting the body's detoxification processes. For more information or to explore whether this approach is right for you, visit the link or scan the QR code to schedule a free discovery consultation.